All right, I'm going to talk about ankles. In this spring and summer season of 2013, the immediate care center is just visited by a multitude of runners, basketball players, soccer players, people with ankle injuries. I just happen to have a model here. This is a foot model, the big toe, and then the four smaller toes, the thing called the midfoot, and then the ankle, which is made up of the fibula and the tibia. This is a right foot. You can see where the heel is and the arch is. This is a right foot. You can see the arch and the inner ankle bone and the outer ankle bone. So the highest amount of fractures and or sprains that we get are usually to the outside. It's relatively difficult to turn and have an inside sprain. It's very easy to have an outside sprain because of the way the ankle is built. And there's one ligament in particular called the ATFL, the anterior talofibular ligament, always gets torn. The question is, how much does it get torn? There's three stages. There's 1, 2, and 3. Partial tear, actually a strain, partial tear, and a full thickness tear. Those determine how fast the ankle can get rehabbed. Nowadays, surgeons don't fix those because the studies have shown that it doesn't benefit. The rehab rate is about the same whether you do surgery or just watch conservatively. The one thing with acute injuries of this ATFL or even any other sprain, deltoid ligament, the posterior calf ligament, is that they need time. If during the time that you are healing up, you re-injure again, there is no protection and the ankle can really continue and break a bone. So that's why we always try to get people in splints. The most common splint is called an air cast splint. It's a splint on the side, another splint on the other side, and then Velcro between the leg. You can actually stick that in a high top basketball shoe. When I was in fellowship in '95, one of the guys, Mark Hutchinson, did a study with the UIC girls basketball team to see if using one before the injury would help in having so many injuries, and most of the basketball players didn't like that because it decreased their jump height. But anyway, that's how important it is to prevent further damage. You can still go forward, but you have to be very careful about side-to-side movements or lateral movements. Soccer playing linemen, very important that you rehab this thing totally before stressing out the ankle again. Some people like wrapping. Athletic trainers will do pre-wrap and then tight taping. It does work, but even the best tape will loosen up after, say, a half or the second quarter of a basketball game. So it is more important to develop, number one, do no further harm. Number two, decrease inflammation with either modalities like physical therapy, iontophoresis, which is steroid, ultrasound, or ice baths, or with medicines, anti-inflammatories. Prescriptions will do a job real fast. Steroids sometimes. If you want to go natural, there's turmeric, glucosamine sulfate, magnesium, and then topicals, and I'll put a link to my talk on topical medicine. Once the inflammation is under control, then we start building up the ankle again. The ankle, when it's kept in a splint and kept in a stiff gait for up to 1 to 2 weeks, you'll lose 20% of the strength in the foot muscles and in the calf muscles. So you have to really be careful about returning back into sports. I really think that it's wise to seek help with a physical therapist to make sure your gait is normal. Make sure that if there is some weakness, you work on strengthening again. And if there is stiffness, which there always is, somebody should help with gaining range of motion back. So you can do it yourself, but sometimes when you have, not sometimes, but always when you have a good physical therapist has a second set of eyes, they can give you objective suggestions on a couple different changes to facilitate. Again, all my patients know that I want to compress the time frame of healing, get either you back to sports, to work, or just out of pain. So we use as much as possible. I have had some nice results with acupuncture in the area. Cupping doesn't help as much. So massage therapy always useful, but again, it depends on the patient, depends on how bad the ankle sprain is. And this is the beauty of integrative medicine and sports medicine together, is we can figure out what best modalities or which best areas of medicine would serve the patient to ultimately get back into the swing of things fastest. So that's what usually happens. The only way to really diagnose a crack is to have an X-ray. There's no way around it. So there are physical signs that we can do to have a high suspicion for a sprain versus a fracture. But truthfully, even if this fibula is fractured, the treatment is still, you can still weight bear because the tibia takes all the weight of the body, unless there's an interosseous, but we're not going to talk about interosseous sprains. So bottom line is, number one, seek out help. Number two, immobilize and try to keep the swelling from accumulating. If you let 24 hours of swelling accumulate, this ankle will be harder to take care of, and again, you'll prolong healing. So when you get the ACE wrap on or the air cast to squeeze, you can push fluid this way, you can push it that way, but if you keep the ankle skinny, faster rehab. And then the use of anti-inflammatories, modalities, different providers, acupuncture, yoga therapy, manipulation with massage, chiropractic sometimes always helpful in getting you back to the swing of things and back to the sport.